Here at Michigan Reproductive Medicine, our focus is on personalized care in a truly private setting. And I've always believed simplicity is very elegant, and also that we must do our best. And in partnering with our patients to advise on what all the treatment options are and get some idea of outcome related to those so that they can see how this fits for their expectations based on their lifestyle, their moral compass, the economics involved are all important. So we really address those different facets of what's going on as a problem and what conditions are a good fit for them to have a healthy baby. And that solution that can be simple doesn't mean we lead with in vitro fertilization therapy. Now, for some folks, that may be the only solution, but there are other options. And we try to go with a more natural approach. And it's sometimes, if nothing else is working, then in vitro fertilization may be the court of last resort. But if done so, whatever step we use has to be with the ultimate safety, with considerations and input by the patients, and we are truly a team approach. We're looking for the most straightforward approach with the least complexity, but leading to the maximum quality and solution for our couples and women to have children. And in doing that, we go through a thorough evaluation and try to see what conditions may be the underlying cause and match treatment specifically there. In this way, we try to minimize the more extensive, complex treatments unless they're absolutely necessary. And it's been such a tremendous satisfier and empowering for our patients. Most often, when we first meet our patients, they feel defeated. They feel they've been trying, it hasn't been working. And they want action. And they want to know, is it really hopeful or am I done? And the reality is, for the vast majority of our patients, there's really good hope for success. But we need to match conditions and treatment. In partnering together, we can do that. And we have state-of-the-art and world-class outcomes for our patients because we apply state-of-the-art knowledge and world-class level efficiency and effectiveness of the care that we provide. And it makes a big difference. It's not enough, though, to be technophiles helping people. People are real people. We all have feelings, we have aspirations, we have visions of having children, going out and playing with our kids, not getting enough sleep, all the other good things that come with it. And in the process of going through treatment, it's really important to support our patients emotionally. One of the most amazing aspects that was very organic in our practice was the start of our fertility support group. It's run by our patients. And folks who have been leaders in Resolve, the fertility support organization nationally, who live locally, were really those that helped us to start our support group. And it's been so helpful for our patients. And the little secret that everyone has learned is that most everyone that's gone to our support group now has kids. We're in the process of it. It really makes a difference to support people emotionally. And we think about stress is affecting fertility, and maybe from the science of it, we can't put that direct connection to will a woman ovulate or will a guy's sperm count be worse when they're stressed. But it can affect behavior. It can affect intimacy. It can affect, oh gosh, this is work to have sex. And it could reduce the opportunity to become pregnant. And we want people to be able to embrace that opportunity and play to win and not worry that they're playing not to lose. There really is hope. And that's something that we're really on the forefront to make sure we infuse within the care for our patients. I'm most proud of our staff. Our staff is awesome. I know I laugh and I can't stop grinning, but we have amazing people. When I say world class, let's just say we're Michigan class too, which to me is world class. And the folks here from our front office team who are not only empathic, everyone's college educated, they can do research, they problem solve, they bring solutions, they engage our patients to solve the challenges for scheduling, for understanding their tests, for making sure things get done right, results get communicated accurately, and expectations are well set. And this transcends from our front office to our amazing nurses who are highly skilled, we have nurse practitioner, nurses doing ultrasounds. They have high levels of technical skill. They're very engaging and very empathic with our patients. And our world-class laboratory embryologists, where we have 15 to 25-year experience for any one embryologist. And we have a good number of embryologists to make sure that we're doing very careful work here, that the embryos that form are the embryos that are yours, that are the embryos that go back to you. Safety and effectiveness and good quality of care and personalized care is what we're about, and it transcends everyone here. It's just amazing. The favorite part of my job is holding the babies. I love it. Or when we can all huddle together with the result of a treatment and get on the phone with someone and surprise them and tell them they're pregnant. We love doing that. And with our really advanced electronic medical record system with Portal, they can look up their results before we can give them a call, and we have to adjust. So we sort of hold back on final review of their pregnancy test result when there are good results. So they have to hold their breath and wait for that phone call. But I'll tell you, our patients have loved it. But holding the babies, so that's so cool. Every year we have a ice cream social where our patients will come back with their kids. And I know I'm getting old when they bring back 12 and 14-year-olds, or someone said my kid's now going to med school. But to help people to really have a chance to have kids, and with all the highs and the lows and the headaches and all, but to have an opportunity to nurture a new wonderful citizen for the world, it doesn't get any better.